Hi, my name is Blake Smith, and this is my community health plan for community health nursing. So community health is about learning about your community. Finding an issue that can be tackled by a nursing student can be a difficult endeavor without first knowing what your community has to offer, where its strengths and weaknesses lie, and what channels are needed to go through to approach problems. I've just moved to my community about a year ago and had a lot to learn about it. My community health project was through with the local community leader, Susie Lutenegger, the Medicare program Silver Sneakers. Learning about my community, I found that there was a need to help prevent falls among seniors. Teaching seniors exercises to improve strength and teaching them how to prevent falls in my community has taught me a lot about how to approach the community I live in. Defining my community. A community is defined as a group of people linked by social ties who are common perspectives and engage in joint action in geographical locations or settings, according to Herzing. Richfield, Minnesota is where the community project will be completed, but Richfield, being so close to other cities, is part of many other communities. Richfield is a first-tier suburb of Minneapolis. It's sandwiched between Edina and Bloomington and Minneapolis, which interconnects many communities. Driving around my city, the only real way to tell where one city ends and another begins are highways. There are 4 main highways that outline the community because it's pretty much a suburban sprawl. It's about 5 to 10 minutes south of Minneapolis. On a good day without traffic, you can get downtown in about 15 minutes. It's not obvious where the community starts and ends unless you've lived in the community for a long time, as the city and neighborhood seem to continue and flow into each other. Overall, the community is well served and appears middle-class majority. There are challenges with some of the community's access to activity during the winter months due to ice and snow. Unfortunately, there's already snow on the ground. It doesn't look good, like it's going anywhere until spring. This also contributes to falls among seniors. The ice and snow can add an extra challenge. Richfield is home to some large employers, and Best Buy is one of the major employers in the area and is headquartered in Richfield. There are plenty of shopping malls, grocery stores, and access to clinics, pharmacies, and hospitals close by. There are bus routes throughout my community, and access is consistent throughout. Community data that I found. In Richfield, it has about 36,000 residents and about almost 7 square miles. It's about 62% white non-Hispanic, with populations of Hispanic, African American, and Indian American making up the majority of the rest of the population. Households in Richfield, Minnesota have a median annual income of about $54,642, which is less than the median annual income of the United States. The closest community hospital is the one that I work at, is Southdale Hospital. It's a 350-bed hospital and is a major stroke and cardiac center for the area. So who do I work with? I worked with Susie Lutenegger, I mentioned before. This is Susie. She's with her oldest class participant, Pat, who is 106. She works with a Silver Sneakers program, which is a Medicare program that provides classes for seniors. Resources through the Richfield Community Center and the high school and the Richfield pool were utilized to complete my project. That's where all the classes were held. The Chamber of Commerce provided some excellent information about the community and some good vital statistics. Also helpful were employees at the Bloomington Health Office who direct community health in the suburban area. They cover Richfield, Edina, and Bloomington. They've just kind of consolidated into one location. So the problem that I diagnosed to deal with was falls in strength. Risk of falls among seniors due to diminishing strength related to inactivity can be improved with education and prevent falls in conditioning classes. Fall-related deaths are on the rise in Minnesota. According to Minnesota Post analysis, there has been a 31% rise in fall-related deaths in 65 and older population over the past decade, pushing Minnesota well above the national average and almost 4 times as many fall-related deaths as the lowest state. The community around me is one of many retirement homes in an older population. Many of these falls in older adults are preventable with education, strength training, and social encouragement to stay connected. I have approached this problem with my mentor through a program called Silver Sneakers. Silver Sneakers is a comprehensive program that improves overall well-being, strength, and social aspects. Designed for all levels and abilities, this program is generally provided by Medicare at no additional cost to Medicare recipients. Silver Sneakers provides access to fitness equipment, group exercises, social networking, online education, and a sense of community. So working out with seniors. The classes are light aerobic activity, walking, water aerobic, and strength exercises. This was done in the community health center, high school, and community pool with a well-established class that has been taught by Susie for the past 30 years. Having the support of such a well-established mentor brought credibility to what I was teaching the seniors about. The pool is also a great place for seniors, which many of them recently had orthopedic surgeries or had pre-existing disabilities that would have otherwise prevented them working out. And I did get into the pool, and you can get a good workout. So teaching the seniors. I also provided some educational material. Education on how to prevent falls was handed out and well received by the seniors. The pamphlets were out by the sign-up area before and after classes for the participants to take. It was also a way for them to reaffirm that they need to take the class and work hard in it. Here's the brochure that I handed out to the seniors. This is just some statistics on how dangerous falls can be, especially for seniors, and some of the costs related to them. These are some tips and tricks to avoid falls in your home, like removing clutter, the importance of communicating with your healthcare provider, and some of the exercises that we did in class and that have been shown to help prevent falls and maintain functional strength. So evaluating seniors was done by asking if they had falls within the time period of the class, but sorry about that. The evaluation of seniors was done by asking if they had falls within the time period of the class, and no one I interviewed had falls. Given the short time span of the project, this was not unexpected. Varying degrees of ability also complicated a clear statistical picture, but after my health plan was completed, overall the consensus to the question, do you feel more confident about preventing falls, was yes. The age range in the class was anywhere from some people were in their 50s even, and up to Pat, who was 106, but the majority were seniors in their 70s and 80s. So, in conclusion, the community mentor that I've worked with, Susie Lutnager, has introduced me to aspects of my community that I didn't know were in place. The community center has been very helpful in helping me work with and educate seniors that participate in the class, and I feel that I've made some positive impact on their fall risks and functional strength. I hope to continue to be involved in improving the health of my community. The goal of helping seniors in the Richfield area preserve functional strength and decrease risks of falls through visiting Silver Sneakers classes and by providing education and assisting with exercise routines has been successful. The program has taught me that diligent care for maintaining strength and can prevent falls and keep seniors independent longer. And these are my references. All right, thank you.